You can find Dr. Alpert at Jonathan Alpert. The Jonathan is A-N, not O-N. Alpert, A-L-P-E-R-T, jonathanalpert.com. Also on X, Jonathan Alpert. Jonathan, welcome back.
Thanks, Dr. Drew. Thanks for having me.
So here we are. There's growing awareness of sort of, psychopathology and the terminology around it. And people are kind of using psychotherapeutic services, and yet we're less well. What are your thoughts?
Yeah, imagine that. We have access to more therapy than ever before, yet rates of anxiety and depression and other mental health issues are higher than ever. So you have to wonder, why is this the case? There are more therapists out there, more people are able to access therapy. But look around, therapy speak is everywhere, and that's part of the problem. We have therapists that are labeling every ordinary life experience as pathologic. So if someone goes to a therapist and they're having a bad day or even a bad week, therapists have a tendency to label them as depressed, or if someone has a bad fight with a boss or a colleague, suddenly they have PTSD. So I think my profession is largely responsible for what we're seeing play out, and certainly consistent with those numbers.
You're tilting at ordinary misery, that ordinary misery, the challenges of life are actually good. They create resiliency and grit and problem solving and all these things. So, sort of trying to relieve every American of any experience of ordinary misery is a fool's errand in terms of being able to do so. And secondly, it's bad for people. And I would argue that the self-esteem movement was similarly destructive. Would you agree?
Yeah, I would agree. And if we pathologize ordinary life experiences, what's the new normal? Is the whole population sick and ill? And are we missing out on building strength and character and resilience? Sometimes we do need to fall in order to build that character and that strength.
Yes, the gift of failure, the gift of challenges. And I mean, it's not fun. We made the same mistake with the opioid crisis. There was a group of professionals that decided pain should not exist in America, and anyone who gets in the way of them is old-fashioned and dangerous and interested in human suffering. We're not interested in human suffering. We're interested in human growth. That necessarily requires a little bit of engagement, let's say, and sometimes misery.
Mm-hmm. Yeah, and I would argue that people aren't growing. They're staying stuck in their pathology, and for some people, a lot of people, it's become a badge of honor. And if you look online at so-called influencers, they're almost like bragging about their depression, their anxiety, their PTSD. Go online and you can find surveys to take to determine if your significant other is a narcissist or borderline. So this isn't helping our society to be healthier and happier. It's actually making us sicker, and it's really wreaking havoc on our society.
So I'm reading some data that says 2025 was America's worst year for mental health in recent memory. That's according to a Gallup research poll. What is the answer here? I mean, well, you give me yours and then I'll share my ideas.
Well, I think therapists need to change the way that they approach patients. They need to change the way that they treat patients. And the problem is that a lot of therapists embrace fragility. They're okay with labeling patients as depressed, even though they're not depressed. They're not challenging patients. I tell a story in my book, Therapy Nation, about someone who saw me, and he had lost a friend to drug overdose. And I had suggested that he may want to, in honor of his friend, stop using drugs and to work on that. And he was so offended by that suggestion. And I actually felt like it was my responsibility as a licensed therapist to make that suggestion.
Of course.
He was offended by that. And he told me he had never had a therapist so directly tell him he needs to stop using drugs. And Dr. Drew, you're an expert in addiction. You know that it's not helping patients to just support the pathology and the use. But this is representative of what's going on. Therapists will just validate and affirm to the point where they're doing a great disservice to patients.
Well, even we have this weirder thing, which is there's this capture of training, mental health training, where the frame is if somebody's been colonialized and they're therefore a victim, and therefore everything that their experience is through this lens of colonialization, which is just shocking.
Oh yeah, yeah. It is shocking, and in my book, I talk about grad schools and how they're turning out social justice warriors first, and maybe clinicians second, or even further down the
Mm,
line. So people aren't learning
mm.
the basic skills of how to diagnose and how to treat mental health disorders.
I think that I think we should be encouraging people to stay away from people like you and me, unless they are dangerously ill or they're having trouble functioning. I would say if you can't function in a relationship, you can't function at work, you really are, some things are breaking down because of your mental health. Well, then by all means, come visit us. But otherwise, I think people should be focused on how to live a good life. And how do you go about that? And not be expecting that necessarily to be something that is handed to you or happens overnight, but that there's the process of engagement. It just seems to me that that would help a lot of our ills, but we just are so narcissistic, we refuse to do that.
Yeah, I agree with you. And therapy has become a lifestyle for some people, for a lot of people. And if you go back to 2012, I wrote an op-ed piece for the New York Times called "In Therapy Forever, Enough Already." And in that piece, I talked about how patients weren't getting better. What I was witnessing
Yeah.
and seeing in my colleagues, they were keeping patients in therapy
Mm.
forever, whether it's a year, 5 years, 10 years, 2 decades. It was endless. And people were just going in every week, venting, getting things off their chest, which can be helpful, but that shouldn't be the end goal of therapy. But that's what was going on. And I know people who have been in therapy for multiple decades, they've spent a fortune, and they're no better off now than they were when they started. They can recite every pathology in the DSM. They're probably better versed at it than I am, but they're no healthier. They're sicker. And you also have to
Do you
look
have
at how much
advice? Go ahead, finish your thought,
advice.
and then you can give me advice for patients to know if they're stuck in a situation they should be
Yeah,
extracting
yeah. I
themselves
think
from.
in some ways you have to look at therapy, your relationship with a therapist, the way you may look at other relationships with service providers in your
Mm.
life. If you were going to a fitness trainer and you weren't getting in shape and gaining strength, would you continue to go back? If you were going to a hairstylist and you didn't like the cut, would you continue to go back? So I think people need to ask themselves, what is the goal of therapy? What is it that they hope to accomplish? And evaluate that. You monitor success and progress throughout treatment, maybe do a check in every month or two and see if they're getting any closer to those goals. And if you're not, you may have to change something about yourself, your motivation, or it could very well be the provider that you're seeing.
Are there any sort of general rules that pertains to those goals? In other words, obviously, if somebody's having trouble functioning, we restore function. But are there sort of things that people should be thinking about in terms of generating their own goals for treatment?
Yeah, and a question that I like to ask patients, usually in the first session: imagine your life 1 year from today. If it's the
Mm,
way it is now, are you okay with that? And it's a good
mm.
question to help to get patients to think about the future and what is it they actually want to accomplish and where do they see themselves a year from now. And I think people who are consumers of therapy can ask themselves that and maybe reevaluate their relationship with therapy. It doesn't need to be a lifelong relationship that they have.
Yeah, I mean, you're actually suggesting something that doesn't often get brought up in therapy, at least in the initial phases, which is changing your life.
Yeah, imagine that concept.
I
Yeah.
know. Well, that's kind of
Well,
what
you know
I'm
what?
saying too. If you're leading a good life, nourishing. But again, we've lost track of what that is in this country, so people are bewildered by even the notion of it.
Yeah, and in my book, I talk about, you can think of therapy almost like the way you would think about seeing a physician for an annual wellness check. If you're doing
Yeah.
okay, you could
Okay.
probably do a check-in once a year or a
Mm,
few times a year, and just to make sure you're
mm.
staying on task and have a healthy lifestyle. But way too often,
Interesting.
therapists are encouraging misuse and overuse of therapy.
Well, listen, I appreciate you being here and bringing up these issues. Let me ask my last question. Really, is Trump derangement real, and what is it?
I've been asked that question a million times, and I give the same answer. It's not in the DSM. I'm not so sure we'll ever see it in the DSM. But from what I see as a therapist who practices in New York and DC and throughout the East Coast, there's a real pathology. I've seen people who are hyper fixated on Trump. They're highly anxious, they're angry. It's affecting
Wild.
their life. So that is pretty consistent with other mental health disorders that do exist.
I
Uh,
talked to a couple of psychologists. One guy was a quant, and she was a more of a psychotherapist, and they had documented this one phenomenon. I don't know if you agree with this, that people with something we're calling Trump derangement have a difficulty with external locus of control. They can't locate their stuff inside themselves, and it's all out there. And he's the boogeyman that's creating everything for me. And on top of that, I always think in terms of people that really get triggered by him. There's nothing more triggering to a narcissist than another narcissist. So it makes me almost wonder diagnostically, people that really get upset about him, are we saying something about you?
Yeah, you may be onto something. And people have asked me, well, what about Biden derangement syndrome? And it's a great question to think about. And I've never had a
It
patient
is.
I've never had a patient who wanted Biden or Harris dead. They didn't wish for it. They didn't root
No,
for it.
no.
Yet I see it on the other side, and that's a real pathology. If you're actually wanting someone dead that you don't even know.
It's interesting. If I think about my own relationship with, say, Biden made me feel frightened because I could see, I know what that is. Those neurodegenerative disorders are. I know what's going on there. I can see it, and my thing was, who's in charge? What's going on here? How do we? I mean, that is so scary to me to look at the captain of the ship and go, well, I know that person's not in shape to do this. Who's doing it? Should I trust them or not trust them? That's more of well, of course, I already have an anxiety disorder, so maybe it's part of that already.
Yeah, but you're not staying up at night with it, probably.
No, I'm not staying up at night. I'm not wishing him demise. I'm wishing truth. I'm wishing their openness and truth. But forgive me. But the last part about the Trump derangement, though, I've noticed is there's so much projection out there these days. I mean, when any disavowed emotions or feelings about the self get slapped onto other people, and they have no idea they're doing it.
Yeah, I mean, there's so much moral reasoning going on, so much judgment. If someone votes for a Republican, they're evil, they're part of MAGA in these people's minds. And long gone are the days where a Republican and a Democrat can be friends or enjoy dinner together. In my own
That's a
life, I've
shame.
had people look at me a little strange just because I appear on Fox, even though my message
Right.
has always been friends and family should come far before politics. So even despite me saying that, they still take issue with my appearances.
I think friends and family before politics is a great place to stop here. Jonathan, we'll look for you on X, Jonathan Alpert. Jonathan Alpert, is it .com also? Yes.
Yes,
Uh,
jonathanalpert.com
and,
and at Jonathan
and,
Alpert.
and then pick up Therapy Nation and read more about this. We'll talk to you soon, no doubt. Thank you.
Yeah, thanks a lot, Dr. Drew. Nice to chat with you.
You bet.